Broadcast Center in Los Angeles. This is KCAL 9 News at 7 a.m.
And we are talking heart health with a cardiologist from Dignity Health this morning. Stay with us. We'll be right back. It's Heart Health Month, and here to bring us up to speed on what we need to do to keep our hearts healthy is Dignity Health cardiologist Dr. Bargout. Thanks so much for joining us. Now, a lot of times people have no idea that they are having a heart attack or heart trouble. Give us an idea of what the symptoms are, the signs, and are they different for men and women?
Sure. Thank you, Amy, for having me. Heart attack is a sudden stoppage to the blood flow to the heart muscle. And as you know, heart disease is number one cause of mortality in this country. The symptoms, usually the most common symptoms, is sudden chest pain. That is the most common symptoms. Crushing, pressure type chest pain. There is some other symptoms: shortness of breath, abdominal pain, jaw pain, upper back pain, lightheadedness, nausea, vomiting. Now, in men, the most common symptoms is chest pain. In women, it's still chest pain, but they do experience some other symptoms, the one that I mentioned: jaw pain, upper back pain. It's important that we take this warning signs very serious. I recommend all my patients, whenever they experience this kind of symptoms, to call 911, because the faster we open up the artery, the better the outcome is.
Okay, and what are some of the things that we can do to prevent heart attacks?
Sure. Heart attack, unfortunately, for the last 50 years, we've done great in terms of prevention, awareness of smoking effect on the heart, diabetes, hypertension. But over the last 20 years, we are plagued with a new epidemic. The obesity rate in this country has gone out of control. 78 million people are obese in this country. So I will say the first and most important thing is treat obesity as a disease, not as an option. You should know your hypertension, you should know your cholesterol level. If you have a family history of heart disease, then talk to your doctor. Those risk factors, if you are diabetic, it needs to be treated. So the most important thing is exercise and diet, and know your risk factors.
And I understand that there are a lot of new treatments now.
That's correct. Over the last 20 years, beside the advance in surgery, in stents technology, medicated stents nowadays, there is new treatment, including medications to treat high cholesterol, treatment for heart failure, new medications. There is even now treatment for valve heart disease that in the past we used to need open heart surgery. Nowadays we can treat it with minimally invasive approach.
And I understand that you guys have a special King and Queen event coming up at Dignity Health?
That's correct. Amy, you know that Dignity Health Glendale Memorial has been serving the city of Los Angeles and Glendale for so many years, since 1926.
Oh, wow.
For the last 24 years, we have an event, we call it the King and Queen Heart Day, where we do free screening for the community. So everyone is welcome to attend, where we do screening for carotid disease, for heart disease, blood pressure, body mass index, which take into account the weight and height and give you a number that will give you some sort of a risk score for future heart events. It have lectures, and it's a great event.
It sounds like it could save lives as well. Thank you so much, Doctor. We certainly appreciate your time. And of course, if you missed any of this interview or you just want to hear it again, go to our website, kcal9.com, and click Seen on TV. We'll be right back.